The Baker administration is working to make sure hospitals have the ventilators they need to handle the surge, which could start later this week. The state's community colleges are about to graduate more specialists to run the breathing machines. From our higher ed desk, WGBH Radio's Kurt Carapezza reports it may not be enough.
4 years ago, fresh out of high school, Leann Ritchie enrolled at Quinsigamond Community College in Worcester.
I knew I wanted to be in the medical field.
The 21-year-old from Sturbridge says she first learned about respiratory therapy from her grandfather, a retired firefighter.
He had cancer of the throat, so he had to get his voice box removed. Usually some people have like the little device that helps them to talk, and it sounds like a robot, but he wanted to talk naturally. Every time he'd have to go to like the hospital, they would always need like a respiratory therapist to help with breathing treatments.
Leann decided that's what she wanted to do with her life. So she signed up for Quinsigamond's 2-year respiratory therapy program.
Poor compliance is often related to shunting. Okay, meaning that the lungs are collapsing. And
today she's wrapping up her courses. Where else? Online.
You can actually fine-tune the vent to meet the patient's ventilatory needs. That's the
At
whole
Quinsigamond,
purpose.
Leann is one of 10 students finishing degrees in respiratory therapy. A WGBH News survey finds, in all, 5 community colleges in the state will graduate about 60 therapists this spring. Many of them could find themselves on the front lines of this pandemic. Administrators say so few graduate because these programs are rigorous and selective. The state says 3,100 respiratory therapists are fully licensed in Massachusetts.
Respiratory therapist is a sort of a new profession.
Speaking to reporters last week, Secretary of Health and Human Services Mary Lou Sutters acknowledged the state could use more therapists, but she pointed out some nurses are also trained to operate ventilators.
So we are hoping that between respiratory therapists and nurse anesthesiologists, you'd have the capacity to use them. And honestly, I want to get the ventilators in Massachusetts and then figure out what we need for staffing in order to use them.
We are heading towards a massive surge.
Juliet Kayam is a former Homeland Security official. She worries even if Massachusetts does receive hundreds of ventilators from the federal government, the state won't have enough staff to operate them.
We need to identify in this state what we have, what we need, and the gap between those two, and begin to fill it now. You can have a ventilator, but if you don't have anyone to work it, you are at a real loss.
In response to the coronavirus crisis, for the first time, Quinsigamond Community College convinced accreditors last month to allow second-year respiratory therapy students to do their clinical training while also being employed by local hospitals.
And at the same time, those hours count towards them completing the degree.
Luis Pedraja is president of Quinsigamond Community College. Pedraja says the respiratory program shows the vital role 2-year colleges play in training the state's workforce, and why when Governor Charlie Baker declared a state of emergency, he deemed community colleges essential.
We provide the people that make the community run, and they all are local.
All of Quinsigamond's second-year respiratory students are now working at local hospitals, and some of the first-year students are preparing to volunteer at a field hospital inside Worcester's DCU Center.
It's exciting, but then makes me more nervous.
Leann Ritchie is on track to graduate at this critical time. She's working at Harrington Hospital in Southbridge, but says she's not running any of these ventilators by herself yet.
I'm assisting. I can't do anything alone until I'm checked off for my competencies.
Still, Leann says she's received emails from other hospitals, desperate for her skills.
It's good to know that respiratory therapists are needed now and actually being recognized instead of just doctors and nurses.
Kurt Carapezza, WGBH, Boston's local NPR.
The story was edited by Ken Cooper. Our higher education reports are a collaboration with the Forum for the Future of Higher Education and made possible with support from Lumina Foundation and the Davis Educational Foundation.